Welcome to the channel. I am a doctor, and today I'll talk about Top Heart Doctor Reveals, the number one sleep habit triggering strokes. After 60. The medical community in 2026 has reached a definitive consensus on a cardiovascular silent killer that was once dismissed as a mere nuisance of aging. While seniors are often told to monitor their salt intake, manage their cholesterol, and walk for heart health, a growing body of research suggests that the most critical determinant of stroke risk after the age of 60 occurs during the hours of darkness. Top heart doctors are now revealing that the number one sleep habit triggering strokes is not how long you sleep, but the specific physiological state of your upper airway and its impact on nocturnal blood pressure. This habit, known as chronic compensated mouth breathing and its associated obstructive events, creates a recurring cycle of oxygen deprivation and pressure surges that act as a mechanical sledgehammer against the cerebral arteries. To understand why this is the primary trigger for late-life strokes, we must deconstruct the physics of the nocturnal dip and the biochemistry of the hypoxic hit. Most seniors get it wrong because they believe that snoring or waking up with a dry mouth is a normal part of getting older, when in reality, it is the visible signal of a brain under siege. To reach the investigative depth required to protect the senior population, we must explore the biological mechanisms of sleep-induced hypertension and how a single change in nighttime behavior can effectively stroke-proof the aging brain. The investigative journey begins with the concept of the nocturnal blood pressure dip. In a healthy cardiovascular system, blood pressure should drop by 10% to 20% once an individual enters deep sleep. This dip provides a vital rest period for the heart and the blood vessels, allowing the endothelial lining to repair itself from the day's oxidative stress. However, when a senior engages in the habit of mouth breathing, often caused by age-related loss of muscle tone in the throat or nasal congestion, this dip is abolished. Mouth breathing is inherently inefficient and shallow. It bypasses the nose, which is the body's primary source of nitric oxide, a gas that dilates blood vessels and thins the blood. Without this steady stream of nitric oxide, the arteries remain constricted throughout the night. This leads to a state known as non-dipping hypertension, where the brain is subjected to high pressure flow for 24 hours a day. In 2026, we recognize that non-dipping is a more accurate predictor of stroke than a high reading in the doctor's office. The second mechanical trigger is the pressure surge cycle associated with microarousals. For many seniors over 60, mouth breathing leads to partial or total collapse of the airway. When the brain detects a drop in oxygen, it triggers a massive surge of adrenaline to wake the body up just enough to resume breathing. This survival spike causes a sudden, violent increase in blood pressure. Imagine a garden hose being stepped on and then suddenly released. The resulting surge of water creates a shock wave. In the brain, these shock waves hit the delicate, aging capillaries of the white matter. Over years, these thousands of nightly surges cause micro-tears and silent bleeds. A senior who wakes up feeling unrefreshed even after 8 hours in bed is likely experiencing hundreds of these internal pressure shocks. In the 2026 clinical landscape, we call this nocturnal vascular battering, and it is the primary reason why strokes are most common in the early morning hours. We must also investigate the role of blood sludge in the nighttime stroke. When a senior breathes through their mouth, they lose significantly more moisture than they would through nasal breathing. This leads to profound nocturnal dehydration. As the water content of the blood drops, the concentration of red blood cells and clotting factors increases, making the blood more viscous. Thick, sticky blood moving through narrowed, high-pressure arteries is the perfect recipe for a clot. Furthermore, the lack of nasal nitric oxide means that platelets are more likely to aggregate or stick together. A senior who has the habit of sleeping on their back with an open mouth is essentially creating a stagnant, high-pressure, prothrombotic environment in their cerebral circulation. This is the silent habit that heart doctors are now warning is more dangerous than a high-fat diet. The fourth investigative piece involves the glymphatic failure caused by poor sleep architecture. The glymphatic system is the brain's waste clearance mechanism, which only functions during deep, slow-wave sleep. It flushes out metabolic toxins, including the proteins associated with Alzheimer's and the inflammatory markers that damage blood vessels. When the habit of mouth breathing and airway obstruction interrupts the sleep cycle, The brain never enters the deep stages required for this cleaning process. The resulting buildup of neural trash causes chronic inflammation in the brain's vascular bed. This inflammation makes the arteries brittle and prone to rupture. In 2026, we understand that a dirty brain is a stroke-prone brain. The habit of disordered sleep breathing is effectively a refusal to let the brain clean itself, leading to a state of permanent vascular vulnerability. To reach the full depth of this analysis, we must address the atrial fibrillation link. The heart and the lungs are inextricably linked by pressure. When a senior struggles to breathe at night, the negative pressure created in the chest to pull in air actually stretches the walls of the heart's upper chambers, the atria. Over time, this mechanical stretching disrupts the heart's electrical system, leading to atrial fibrillation, AFib. AFib allows blood to pool in the heart, where it can form a large clot that eventually travels to the brain, causing a catastrophic stroke. Heart doctors have found that treating the sleep habit is often more effective at stopping AFib than medication alone. By closing the mouth and ensuring steady nasal airflow, the senior removes the physical pull on the heart muscle, allowing the electrical system to stabilize. The investigative framework of 2026 also focuses on the cortisol-stroke connection. Every time the body is forced to gasp for air or snort during sleep, the adrenal glands release a burst of cortisol. While cortisol is necessary for waking up, having high levels of it throughout the night causes the blood vessels to remain stiff and unresponsive. Chronic nighttime cortisol elevation also drives up blood sugar, even in non-diabetics. High blood sugar syrupifies the blood and damages the glycocalyx, the protective fur-like lining of the blood vessels. Once the glycocalyx is destroyed, the arteries lose their ability to produce their own vasodilators. This creates a vicious cycle where the sleep habit destroys the very infrastructure meant to protect the brain from a stroke. The solution being promoted by top doctors in 2026 is the nasal dominance protocol. This involves more than just trying to breathe through the nose. It includes the use of medical-grade mouth tape, side-sleeping pillows, and mineralized nighttime hydration. Mouth taping, once considered a fringe biohack, is now a mainstream clinical recommendation for seniors. By gently ensuring the lips stay together during sleep, the senior forces the body to utilize the nasal passage, which humidifies the air, filters out irritants, and maximizes nitric oxide production. This single, 1-minute habit before bed can lower nocturnal blood pressure by as much as 15 points. It stabilizes the heart rhythm, prevents the adrenaline surges, and allows the glymphatic system to perform its vital cleaning work. We must also deconstruct the sleep position trap. Many seniors sleep on their backs because of joint pain or force of habit. However, gravity causes the tongue and soft palate to fall backward, obstructing the airway. This is supine-dependent stroke risk. In 2026, heart doctors recommend positional therapy, where seniors are trained to sleep on their sides. This keeps the airway open and reduces the mechanical load on the heart. When combined with nasal breathing, side sleeping creates a low-pressure highway for blood to reach the brain. For a senior over 60, this is the most important exercise they can perform, the exercise of maintaining a patent airway for 8 hours of rest. Furthermore, we must address the nocturnal urination paradox. Many seniors believe they wake up at night because they have a small bladder. In reality, when the heart is stressed by mouth breathing and airway obstruction, it releases a hormone called atrial natriuretic peptide, ANP. This hormone tells the kidneys to produce more urine to lower the blood volume and reduce the pressure on the heart. If a senior is waking up multiple times to use the bathroom, it is often a sign that their heart is struggling to breathe. By fixing the sleep habit, the ANP surge stops, and the senior can sleep through the night. This prevents the orthostatic shock of getting out of bed quickly at 3 a.m., which is another common trigger for morning strokes. The final piece of the 2026 investigative model is the inflammation-oxidation nexus. The repetitive drop in oxygen levels followed by a sudden reoxygenation, known as intermittent hypoxia, is incredibly damaging. It creates a reoxygenation injury, where free radicals flood the brain's circulation. This is similar to what happens during a heart attack or a major stroke, but it happens on a microscale every single night. These free radicals rust the cerebral arteries from the inside out. By ensuring a steady, unbroken flow of oxygen through nasal breathing, the senior prevents this nightly rusting process. This is the ultimate anti-aging therapy for the brain. It preserves the integrity of the blood-brain barrier and ensures that the white matter remains vibrant and functional. In conclusion, the doctor's warning is clear. The number one sleep habit triggering strokes after 60 is the failure to maintain a quiet, nasal, and unobstructed airway. Mouth breathing, snoring, and sleep apnea are not benign signs of aging. They are the mechanical drivers of vascular decay. By reclaiming the night through the nasal dominance protocol, seniors can effectively lower their stroke risk more than almost any other single intervention. The future of heart health is not just found in the pharmacy, but in the silence of the bedroom. Your brain requires a constant, gentle, and oxygen-rich environment to survive. By closing your mouth, breathing through your nose, and sleeping on your side, you are giving your brain the vascular peace it needs to thrive. The 2026 path to longevity is paved with the wisdom of the breath. Honor your heart's need for nocturnal rest, and it will protect your mind for decades to come. As the sun sets and the body prepares for rest, the transition into the cardiac danger zone begins. For those who ignore the habit of mouth breathing, this transition is a descent into a state of physiological emergency. The heart, already dealing with the stiffened arteries of the senior years, is forced to compensate for a lack of oxygen by increasing its output. This creates a state of metabolic exhaustion by the time morning arrives. This is why many seniors feel more tired when they wake up than when they went to sleep. Their body has spent the night in a marathon of survival. The doctor's revelation is that we have the power to stop this marathon. Through the simple discipline of airway management, we can ensure that sleep is a time of restoration rather than a time of risk. The investigative journey into senior stroke prevention ends with the concept of vascular resilience. A resilient brain can handle the occasional stressor, but a brain battered by 8 hours of nightly mouth breathing has no reserves left. The number one habit is to stop the battering. By using the tools available in 2026, from high-quality sleep trackers that monitor oxygen saturation to simple mouth tape, seniors can become the architects of their own cardiovascular safety. This is the shift from being a passive sleeper to being an active protector of the brain. The data is undeniable. The way you breathe while you sleep is the most important story your heart tells. Make it a story of steady rhythms, clear channels, and deep healing rest. Your life depends on it. To deepen this investigation, we must also consider the carotid baroreceptor response. Located in the neck, these sensors monitor blood pressure and tell the brain how to adjust the heart rate. In seniors, these sensors often become less sensitive due to arterial stiffness. When a senior experiences the adrenaline spikes of obstructed mouth breathing, these faulty sensors can't keep up, leading to erratic heart behavior. This autonomic instability is a primary reason why minor stressors the next day, like a loud noise or a sudden movement, can trigger a stroke. The brain is already on a hair trigger because of the nighttime habit. By stabilizing the breathing at night, you recalibrate these sensors, allowing the body to handle the demands of the day with far more grace and safety. Furthermore, we must address the microemboli shower. Studies in 2026 have used transcranial Doppler to show that during periods of severe mouth breathing and snoring, tiny vibrations in the neck can actually loosen microscopic pieces of plaque from the carotid arteries. These microemboli travel into the brain, causing mini strokes that may not show symptoms immediately, but lead to a gradual loss of cognitive function. A quiet, nasal breathing sleep prevents these vibrations, keeping the plaque stable and the brain clear. This is the mechanical stability that top doctors are now prioritizing. Finally, the CO2 buffering capacity of the blood is crucial. Mouth breathing blows off too much carbon dioxide, which paradoxically causes the arteries to constrict even further. This is known as the Bohr effect. To get oxygen into the tissues, you actually need a healthy level of CO2 in the blood. Nasal breathing maintains this balance, ensuring that the oxygen you do take in actually reaches the brain cells. A mouth-breathing senior might have 98% oxygen in their blood, but their brain could still be starving because the CO2 levels are too low to let the oxygen unlock from the hemoglobin. This cellular starvation is a silent driver of neural death. By fixing the sleep habit, you ensure that the oxygen is not just in the blood, but in the brain. The 2026 path to a stroke-free life is a return to biological basics. It is the recognition that the mouth is for eating and the nose is for breathing. For a senior over 60, this is the ultimate health secret. It costs nothing, requires no surgery, and has no side effects other than a more vibrant, clear-headed life. The number one sleep habit is the final frontier of geriatric medicine. Reclaim your breath, and you reclaim your future. Your heart is an adaptable, intelligent organ, but it cannot perform miracles without oxygen. Give it what it needs through the night, and it will serve you faithfully through the day. This is the truth that is saving lives across the globe in 2026. The silent habit of the night is the loudest predictor of the stroke. Listen to the warning, close the mouth, and wake up to a life of resilience. Beyond the immediate mechanical and chemical factors, we must also examine the bioelectrical synchronization of the brain and heart during optimized sleep. In 2026, neurologists have found that when a senior breathes through their nose and maintains a steady airway, the brain's delta waves synchronize with the heart's RR intervals. This coherence is the hallmark of a system in total recovery. When this synchronization is broken by the habit of mouth breathing, the brain remains in a hypervigilant state, similar to post-traumatic stress. This hypervigilance keeps the blood vessels under high tension even during sleep. By restoring nasal dominance, the senior is essentially peace-treating their own nervous system. We must also deconstruct the antihistamine stroke link. Many seniors take nighttime allergy medications or sleep aids that have a drying effect on the mucous membranes. This encourages mouth breathing by causing the nasal passages to swell and dry out. In 2026, we are seeing a correlation between the long-term use of these drying agents and an increased risk of ischemic stroke. The habit is often reinforced by the very medications intended to help. Heart doctors now recommend natural saline rinses and air humidification as vascular-safe alternatives that keep the nose open and the mouth shut. The investigative journey also leads us to the thermoregulation of the brain. The nose acts as a heat exchanger, cooling the blood before it reaches the brain. A cool brain is a brain that requires less oxygen and is more resistant to injury. Mouth breathing pulls in warm, unfiltered air, which fails to provide this cooling effect. During the early morning hours, when the body temperature is naturally lowest, a mouth-breathing senior may have a brain that is overheated metabolically. This increased metabolic demand in a low-oxygen environment is a recipe for cell death. Nasal breathing acts as a radiator for the brain, keeping it at the optimal temperature for vascular stability. Finally, we address the social vascular effect. Seniors who sleep with a partner often mask their sleep habits out of embarrassment or a desire not to disturb the other person. They might roll onto their back to avoid snoring toward their partner, inadvertently increasing their stroke risk. In 2026, we promote collaborative sleep health, where partners help each other monitor for mouth breathing and obstruction. A partner who notices an open mouth or a choking sound is not just witnessing a bad sleep habit, they are witnessing a stroke warning sign. By working together to implement the nasal dominance protocol, couples can protect each other's neurological health. The number one sleep habit, maintaining nasal breathing, is a form of internal medicine that you dispense to yourself for 8 hours a day. It is the most powerful tool in your longevity toolkit. As you prepare for bed tonight, remember that your heart and brain are a team. They are counting on you to provide the oxygen and the pressure stability they need to keep you here, vibrant and whole. Close the mouth, open the nose, and step into a future of vascular resilience.